The 5 silent signs of a heart attack every senior over 60 must know. What if the first sign of a life-threatening heart attack wasn't a dramatic, movie-style pain in your chest, but a feeling you might be dismissing right now? For many people over 60, the most dangerous warnings are silent. They can feel like simple fatigue, a bit of indigestion, or even an ache you'd blame on a bad night's sleep. We're often told these are just normal parts of getting older, but what if that belief is dangerously wrong? What if we've been trained to ignore the very signals our body sends when it's in critical trouble? A startling number of heart attacks occur without the person even realizing it. Some studies suggest nearly half of all heart attacks may be silent, while the CDC states that about 1 in 5 are. These events cause real, physical damage to the heart muscle and are especially common in adults over 60. The symptoms are often subtle, not because the event isn't serious, but because our bodies can send confusing signals as we age. This is particularly true for women, who are more likely to experience these atypical symptoms. The real danger isn't just the heart attack itself, it's the fact that it goes unrecognized. Without that classic crushing chest pain, many people delay seeking the life-saving care they need, and that delay can lead to irreversible heart muscle damage. But here's the good news. Your body often whispers before it screams. Learning to recognize those whispers is one of the most powerful things you can do for your health. In this video, we'll break down the 5 subtle signs of a silent heart attack that every senior needs to know. Understanding these signs isn't about creating fear, it's about giving you the knowledge to be an advocate for your own health. It could save your life. Sign number 1. Unexplained, profound fatigue. The first silent sign is one that's incredibly easy to overlook, a deep and unexplained fatigue that is incredibly easy to overlook. This isn't the normal tiredness you feel after a busy day. This is a heavy, overwhelming exhaustion that settles deep in your bones and isn't fixed by a good night's sleep. Many people who've had a silent heart attack recall feeling unusually drained in the days or even weeks leading up to it. It might feel like you have the flu, but without the usual fever or aches. Suddenly, simple tasks like making the bed or walking to the mailbox can feel like climbing a mountain. So why does this happen? A heart attack is caused by a blockage that cuts off blood and oxygen to part of your heart. When the heart muscle is starved of oxygen, it has to work much harder to pump blood to the rest of your body. This extra effort drains your energy, leading to that profound sense of weakness and fatigue. This symptom is especially common for women. One study published in the journal Circulation found that about 70% of women experienced unusual fatigue in the month before their heart attack. The real danger of this symptom is how easily we explain it away. It's so easy to say, "I'm just not as young as I used to be." That simple dismissal can be one of the most dangerous phrases in a senior's vocabulary. If you're hit with a level of fatigue that is new, severe, and doesn't have a clear cause, it's a whisper from your body that you must not ignore. Sign number 2. Discomfort in your jaw, neck, or upper back. The second silent sign challenges the whole idea that a heart attack is just about the chest. It's pain or discomfort in your jaw, neck, or upper back. This is rarely a sharp, intense pain. Instead, it's often a dull ache, a feeling of pressure, or a nagging discomfort you just can't shake. The pain might radiate up into your jaw, sometimes feeling like a toothache that has nothing to do with your teeth. It can also settle in your neck, or very commonly, between your shoulder blades. Women in particular often report a feeling of squeezing or like a rope being tied around their upper back. The reason this happens is due to referred pain. Your heart doesn't have a lot of nerve endings, so when it's in distress, it sends signals up the spinal cord. Nerves from your jaw, neck, and arms share these same pathways, and the brain gets confused. It misinterprets where the distress signal is coming from, making you feel the pain in your back instead of your chest. This is one of the most frequently misdiagnosed signs. Jaw pain is easily blamed on a dental issue. Neck and back pain are often chalked up to sleeping funny or arthritis. You might even go to a dentist or a chiropractor for relief when the real problem is a blockage in a coronary artery. If you feel a nagging, persistent ache in these areas, especially if it gets worse with exertion and you can't explain it, it could be your heart sending a critical warning. Sign number 3. Mild indigestion, heartburn, or nausea. The third silent sign is one that millions of people experience for harmless reasons every day: indigestion, heartburn, or nausea. This symptom often feels like a burning sensation in the upper abdomen, bloating, or a general feeling of fullness, even if you haven't eaten much. It might come with a wave of nausea. Because these feelings are so common, we almost automatically dismiss them. We blame it on last night's spicy dinner or a chronic issue like acid reflux. The reason this can signal a heart attack is all about location. The lower part of the heart sits right above the stomach. When the heart muscle is being deprived of oxygen, it can irritate the nerves in that area, creating symptoms that perfectly mimic a stomach issue. So how can you tell the difference? Heart-related indigestion often appears suddenly, may not be related to food, and might be accompanied by other subtle symptoms like lightheadedness or a cold sweat. While heartburn from acid reflux usually gets worse when you lie down, cardiac-related discomfort tends to stick around no matter your position, and crucially, it won't get better with antacids. For women and seniors, this is a major red flag that's frequently ignored. If you experience what feels like bad heartburn or indigestion, and it feels different or more persistent than usual, or if it's paired with any other sign on this list, it's essential to consider that it might not be your stomach at all. Sign number 4, shortness of breath without exertion. The fourth silent sign is finding yourself suddenly short of breath, with or without any chest discomfort. This isn't feeling winded after climbing a few flights of stairs. This is getting breathless while doing something simple, like walking across the room, or even while you're just sitting still. You might feel like you just can't get enough air in, a sensation that is both scary and easy to rationalize. There are two main reasons this happens during a heart attack. First, when a blockage stops your heart from pumping blood effectively, your body isn't getting enough oxygen. Your brain senses this and tells your lungs to breathe faster to try and compensate. Second, a struggling heart can cause fluid to back up into the lungs. This fluid makes it physically harder for your lungs to expand, causing that distinct feeling of breathlessness. This is another symptom we're experts at ignoring as we get older. We chalk it up to being out of shape or maybe gaining a little weight. However, if shortness of breath comes on suddenly, feels completely out of proportion to what you're doing, or gets worse when you lie down, it's a critical warning. It's a direct signal that your heart and lungs are under immense strain. Sign number 5, dizziness, lightheadedness, or a cold sweat. The fifth and final silent sign is a trio of symptoms that signal your body is in distress: sudden dizziness, lightheadedness, or breaking out in a cold sweat. This might feel like a sudden wave of lightheadedness, as if you might faint, or the room suddenly starts to spin. At the same time, you might break out in a clammy, cold sweat, even if you aren't hot or exercising. These symptoms often happen together and can be accompanied by nausea. The cause is directly tied to the heart's reduced ability to do its job. During a heart attack, the heart's ability to pump blood drops significantly. This means your brain may not be getting the steady supply of oxygenated blood it needs, leading to dizziness. The cold sweat is a classic fight or flight response from your nervous system. It recognizes the cardiac event as a major threat and triggers a stress reaction. Once again, these are symptoms that are so easy to explain away. Dizziness can be blamed on standing up too fast or dehydration. A sudden sweat might be brushed off as a hot flash or anxiety. While those can be the causes, when these symptoms happen for no clear reason or in combination with other subtle signs like fatigue, they form a pattern that could be pointing to a cardiac emergency.
What to do? Your action plan. Recognizing these signs is step 1, but what you do next is what saves lives. The symptoms of a heart attack can sometimes be confused with a panic attack, which also causes a racing heart and sweating. However, panic attacks often peak within minutes and then fade, while heart attack symptoms tend to persist or get worse. In a moment of crisis, you can't afford to guess. If you experience any of these 5 symptoms, unexplained fatigue, jaw or back discomfort, weird indigestion, shortness of breath, or dizziness, especially if they're new, persistent, or happen together, here is your non-negotiable action plan. 1. Call emergency services immediately. In the US and Canada, that's 911.
In the UK, it's 999. Do not drive yourself to the hospital. Paramedics can start life-saving treatment the moment they arrive. In emergency medicine, they say time is muscle, and every minute you wait, more heart muscle is at risk. 2. Chew one aspirin. If you're not allergic and your doctor has said it's okay, chew one 325 milligram uncoated aspirin. Aspirin helps thin the blood and can reduce the severity of the clot causing the blockage. 3. Stay calm and rest. Sit or lie down in a comfortable position and loosen any tight clothing. Try to remain as calm as possible while you wait for help. If you can, unlock your front door so emergency services can get in easily. The Hollywood heart attack, with its dramatic chest clutching and collapse, is a dangerous myth for many seniors. The reality is often quieter and far more confusing. Let's quickly recap the 5 silent signs. 1. Deep, unexplained fatigue. 2. Discomfort in the jaw, neck, or back. 3. Indigestion or nausea that feels unusual. 4. Shortness of breath for no reason. And 5. Sudden dizziness or a cold sweat. Your body often whispers before it screams. These symptoms are those whispers. Learning to listen to them, to question them instead of just dismissing them as part of getting older, is a profound act of self-care. It empowers you to be the guardian of your own health. Don't let these silent warnings go unheard. If this information was valuable to you, please like this video, subscribe for more health content, and most importantly, share it with another senior in your life. You never know whose life you might help save.